Surgery Science for 6th semester students of the Faculty of Medicine. 1. Introduction to Surgery. Definition. Surgery is a medical specialty focused on diagnosing and treating diseases through physical interventions or surgical procedures. Basic principles. Asepsis. Maintaining a sterile environment during surgical procedures to prevent infection. Hemostasis. Stopping bleeding during and after surgery. Wound healing. Understanding the stages of wound healing, inflammatory phase, proliferative phase, and remodeling phase. 2. General principles of surgery. Preoperative preparation. Ensuring the patient is physically ready for surgery, including fasting, preoperative antibiotics, and necessary lab tests. Intraoperative care. Anesthesia. Choosing the appropriate type of anesthesia, local, regional, general. Surgical technique. Selecting the best approach based on the patient's condition and surgical goals. Postoperative care. Pain management, monitoring vital signs and ensuring wound care to prevent infections or complications. 3. Types of surgery. Minor surgery. Procedures that involve small incisions and minimal tissue damage, such as abscess drainage or removal of superficial tumors. Major surgery. Involves larger incisions and more extensive tissue manipulation, like organ transplantation, open heart surgery, or cancer resection. 4. Surgical specialties. Cardiothoracic surgery. Surgery on the heart and lungs, including coronary artery bypass grafting, CABG, or lung cancer resections. Neurosurgery. Surgery on the brain, spine, and nerves. Procedures include brain tumor excision or spinal cord decompression. Orthopedic surgery. Surgery related to bones and joints, such as fracture fixation or joint replacement. General surgery. Includes the treatment of conditions like appendicitis, hernias, and gallbladder disease. 5. Indications for surgery. Emergency surgery, needed to address life-threatening conditions such as trauma. Appendicitis, or bowel perforations. Elective surgery. Planned surgeries such as cholecystectomy, gallbladder removal, for symptomatic gallstones or cosmetic surgery. Palliative surgery. Performed to relieve symptoms in patients with terminal conditions, such as tumor debulking to ease pain. 6. Surgical techniques. Open surgery. Involves large incisions to directly access organs or structures. Examples: abdominal surgeries or thoracotomies. Minimally invasive surgery, using smaller incisions and instruments like laparoscopes. This includes laparoscopic cholecystectomy or laparoscopic appendectomy. Robotic surgery, assisted by robotic systems, allowing for more precision in complex procedures. 7. Surgical instruments. Scalpel, A small, sharp knife used for making incisions. Forceps. Tweezer-like instruments used to grasp tissues or objects. Needle holder. Used to hold needles while suturing. Sutures and staples. Used to close incisions or wounds post-surgery. 8. Anesthesia in surgery. Local anesthesia, numbing a small area for minor procedures, e.g., skin biopsy. Regional anesthesia, numbs a larger part of the body, such as an epidural used in childbirth. General anesthesia, induces a reversible loss of consciousness for major surgeries. 9. Postoperative complications. Infection. Post-surgical infections can occur at the wound site or internally, requiring antibiotic treatment. Bleeding. Excessive bleeding during or after surgery can result in hematomas or require blood transfusions. Thromboembolic events. Post-surgical blood clots, such as deep vein thrombosis, DVT, or pulmonary embolism, PE, can occur and may need anticoagulant therapy. Wound dehiscence, a condition where the wound reopens, usually due to poor healing or infection. 10. Wound healing. Phases of healing. Inflammatory phase. Initial response with bleeding and clot formation. Proliferative phase. Formation of new tissue and blood vessels. Remodeling phase. Maturation and strengthening of the new tissue. Factors affecting healing, nutrition, oxygenation, infection control, and diabetes management. 11. Surgical risk assessment. Preoperative evaluation includes assessing the patient's medical history, physical examination, and necessary tests, blood work, imaging. ASA classification. A scale used to determine the patient's overall fitness for surgery. American Society of Anesthesiologists classification. 12. Case studies and clinical scenarios. Case 1. A patient presenting with acute appendicitis. Surgical intervention. Appendectomy. Case 2. A patient with a perforated ulcer requiring laparotomy. Case 3. A patient with a hernia requiring elective herniorrhaphy.